Hello everyone, let me introduce my PhD topic in mobile motion analysis system. My name is Azamat Bissenov. I am second year PhD student. My vision is high quality health change behavior and the personalized medical care for disabled people. To pursue of this vision, my mission is to promote the widespread use of mobile motion analysis system for easier diagnosis and a more accurate treatment of musculoskeletal disorders. There are two specific goals related to my PhD topic. Today, we will talk about first two. My first project is titled Investigating the Validity of Inertial Measurement Unit on Gait Parameters in Ambulatory Individuals. The gait refers how we walk. It's complex motor function that involves coordination of multiple body systems, coordinated movement of muscles and the joints. And the impairment of gait is particularly common in several diseases, such as osteoarthritis, cerebral palsy, and stroke survivals. Nowadays, the gold standard to assess gait parameters is 3D motion analysis system, which is known for its accuracy and reliability, but characterized with higher costs and technical complexities. But nowadays, alternative system exists, which is inertial measurement units, which offer good option, which is characterized by cost effectiveness, portable, and to be able to use out of hospital condition, which makes it more accessible. However, the validity of inertial measurement units should be evaluated to ensure can they provide clinically reliable results or not. From this, my aim to evaluate the validity of EAMU for motion tracking. In this picture, you can be familiar with both systems. 3D motion analysis system requires dedicated place with specialized camera. Also, experienced staff who can apply and perform this system for individuals. In the next picture, you can see alternative system, inertial measurement system units. By some wearable sensors in the mobile phone, you can assess some gait parameters by using mobile phone. From this, my clinical question arises. Does EAMU have clinically acceptable validity in measuring gait parameters? My population is ambulatory individuals, index test EAMU, reference test, gold standard 3D motion analysis system, diagnosis of interest gait parameters. Our hypothesis, EAMU technology demonstrates comparable validity in capturing gait parameters. Our systematic search was conducted by using 4 domains in 4 databases. Approximately 15,000 hits was found. By narrowing it down, 23 full article was chosen. Before I introduce my forest plot, I would like to little bit explain our outcome measure. To evaluate accuracy of EAMU compared to 3D motion analysis system, we use statistical metrics which called root mean square error. Root mean square error evaluate difference between gold standard and the EAMU. If difference is low, which indicates root mean square error, which means accuracy is better. If error is high, root mean square error is high, which indicates less accuracy. By using this statistical metrics root mean square error, we focused in 3 particular joints we usually use during the walking. It's ankle joint, knee joint, and the hip joint. Particularly, we focused on the range of motion during the walking in sagittal plane. Range of motion is crucial tool for clinician to assess joint mobility, to monitor rehabilitation progress. So by using this root mean square error, we focused in three joints, and we try to evaluate the difference between EAMU and the gold standard. So our first outcome is ankle joint angle in sagittal plane during the walking. We used the root mean square error for outcome measure, outcome units in angle. Acceptable threshold is 5 degrees. If error from EAMU is more than 5, it's not acceptable. So overall, 140 individuals included for first forest plot. For overgrown walking, pulled root mean square error 4.15. For treadmill walking, 5.46. Overall root mean square error 4.62, which indicates that results from EAMU under the acceptable accuracy. For second knee joint in sagittal plane, we used similar outcome units, similar outcome measure. Overall, 225 individuals included for this plot. For overground walking, pulled root mean square error 4.81. For treadmill walking, 5.19. Overall root mean square error 4.93, which also under the acceptable accuracy. Our third outcome, hip joint angle during the walking, pulled root mean square error for overground walking 5.08, for treadmill walking 6.94, overall root mean square error 5.79, which is out of acceptable accuracy. In conclusion, I can say the EMU-based gait analysis system showed clinical acceptable validity compared to the 3D motion analysis system for knee and the ankle joint. In practice, it's allowed to use this analysis system where 3D motion analysis system unacceptable. Secondly, it allowed to use this system out of laboratory condition. For research, EMU-based system should be evaluated because root mean square error for hip joint out of acceptable accuracy. So our first project finalized and was submitted for Medicine, Science in Sports and Exercise G1 journal. Our second project is called Evaluating the Validity and the Reliability of Inertial Measurement Units for Balance Assessment. Balance is crucial during the daily activities, running and walking. It's usually impaired in the neurological and the musculoskeletal disorders. Every year, approximately 13.5 million individuals annually have fractures because of falls. The vertebral fractures, the most common among them. Every year, 1 in the 3 individuals over the age 65 experience at least one falls annually. These statistics indicates the importance of proper balance assessment. Nowadays, the gold standard to assess balance which is force plot, which requires traditional 3D motion analysis laboratory. Alternative system also EMU, which is cost-effective and portable. This also needs to be validated against the 3D motion analysis system with force plot. Our aim from this study to assess validity and the reliability of inertial measurement units for balance assessment. In this picture, you can clearly see these both systems to be familiar. Force plate and the EMU. From this, our clinical question arises: how valid and reliable EMU assessing balance compared to force plates? Our population ambulatory individuals index test EMU, also similar reference test force plate, diagnose of interest balance parameters. Our hypothesis: EMU measurements will be reliable and have clinical acceptable validity compared to force plates. Our implication for clinical and research: improve balance assessment and accessibility tools. Our systematic search was conducted in 7th of October 2024 by using these 2 domains. Our Prospero was registered, duplicate removal is done. Now we are working in the title and the abstract selection with my co-investigator. So our first project was submitted in January 2024, and the second project we hope to finalize in May 2025. So I would like to finalize my presentation by Hippocrates' quote, "Walking is man's best medicine." Thank you for your attention.
Thank you for your presentation, Azamat. Can you elaborate more for the second project, whether you will use dynamic or static balance parameters?
Thank you for your question. In our second project, we focused on static balance parameters more than dynamic balance parameters, because static is more reliable and less variable, and it's commonly used to assess balance. Because in dynamic static parameters, it's variable depending on exercise, and we would like to investigate static balance parameters.
I know it's not a real fair play to ask you as your supervisor, but would you please explain in details why is it useful to have a mobile measurement unit instead of laboratory Vicon system?
Thank you for your question. First of all, it's depending on cost effectiveness. 3D laboratory analysis system is very expensive compared to mobile. Secondly, it's more comfortable for patients which have disability. So you can progress, rehabilitation progress, everything at home to see how your treatment progress is working by using mobile motion analysis system. Overall, it's comfortable and cost effective.